Knee pain while walking, especially on one side of the joint, is often the earliest sign of knee osteoarthritis. This condition is called osteoarthritis or OA, which is a degenerative wear and tear disease of the knee joint. The knee joint is formed by the femur, tibia, and patella, supported by articular cartilage, ligaments, and surrounding muscles. In a healthy knee, smooth articular cartilage allows low friction movement and even distribution of body weight across the joint. In osteoarthritis, this cartilage gradually thins, develops cracks, and loses its shock absorbing capacity. As cartilage reduces, mechanical load is transferred directly to the underlying bone, increasing friction and stress within the joint. This abnormal stress triggers synovial inflammation, leading to pain, swelling, and tenderness. Patients commonly experience stiffness after rest because joint lubrication is reduced and the capsule becomes tight. Pain typically worsens during activities like climbing stairs, squatting, or prolonged walking as joint forces increase during these movements. Aging, excess body weight, knee malalignment such as bow legs, and previous injuries all increase joint loading and accelerate cartilage wear. When thigh muscles are weak, a larger proportion of body weight is transmitted directly through the knee joint surfaces. This is where exercise becomes crucial, even though damaged cartilage itself cannot regenerate. The quadriceps muscle is the primary dynamic stabilizer of the knee during standing and walking. When these muscles are strong, they absorb ground reaction forces before those forces reach the joint cartilage. This unloading effect significantly reduces compressive stress on already damaged cartilage. Muscle strengthening also improves joint stability, reducing abnormal wobbling and excessive movement that speed up cartilage breakdown. Better muscle control improves overall limb alignment and redistributes forces more evenly across the knee. Smoother, well controlled movement reduces harmful shear forces acting on the cartilage surface. Regular movement during exercise also pumps synovial fluid across the joint, improving cartilage nutrition and lubrication. Over time, this reduces inflammatory mediators inside the joint and decreases pain signaling. As a result, patients experience less pain, better walking ability, and improved confidence in daily activities. Clinical studies consistently show that regular strengthening exercises slow functional decline and disease progression in knee osteoarthritis. For this reason, exercise forms the foundation of all international treatment guidelines for OA knee. Strong leg muscles ultimately act like a natural knee brace, helping to control pain, protect the joint, and delay injections or knee replacement surgery. Let us see what exercise to be done to prevent knee osteoarthritis. Knee exercises for osteoarthritis should always be done on a firm bed or exercise mat, moving slowly and only within a pain-free range. Mild discomfort is acceptable, but sharp pain should be avoided. Breathe normally throughout the exercises and never hold your breath. Begin with about 10 repetitions of each exercise once or twice daily and increase gradually as tolerated. Start with quadriceps isometric exercises by lying flat on your back with both legs straight, placing a rolled towel under the knee, pressing the knee down into the towel to tighten the thigh muscle without lifting the leg, holding this contraction for 5 seconds, then relaxing. Repeat this 10 to 15 times to strengthen the thigh muscles and reduce load on the knee. Next, perform straight leg raises by lying on your back, bending one knee while keeping the other leg straight, tightening the thigh muscle of the straight leg, slowly lifting it to about 30 degrees, holding for 3 seconds, and then lowering it slowly, ensuring the knee remains straight throughout. Repeat 10 times. Seated knee extensions are done by sitting upright on a chair with feet flat on the floor, slowly straightening one knee, holding for 3 seconds at the top, and then lowering it back down in a controlled manner. Repeat 10 to 15 times to improve knee strength and control. For standing hamstring curls, stand holding a chair or wall for support. Bend one knee to bring the heel toward the buttock while keeping the thighs vertical and the body upright. Then slowly return to the starting position. Perform 10 repetitions on each leg to strengthen the muscles behind the knee. Hip abductor strengthening is done by lying on your side with the bottom knee slightly bent, the top leg straight and toes pointing forward, slowly lifting the top leg upward without rolling the body backward and then lowering it slowly. Repeat 10 times on each side to improve knee alignment and stability. Functional strengthening includes sit to stand exercises where you sit on a chair with feet shoulder width apart, slowly stand up only halfway while keeping the knees aligned over the toes, and then slowly sit back down. Perform 8 to 10 repetitions and avoid deep squatting. Step up exercises are done using a low step or staircase by stepping up with one leg, keeping the knees straight and controlled, stepping down slowly, and using a handrail if needed. Repeat 8 to 10 times on each leg to strengthen the knee for daily activities. Finally, wall supported mini squats are performed by standing with your back against a wall, feet shoulder width apart, sliding down slightly until the knees bend only about 30 degrees, holding for 5 seconds, and then sliding back up. Repeat 8 to 10 times and avoid deep squats. These exercises do not cure knee arthritis, but when done regularly, they protect the knee joint, reduce pain, improve function, and help delay injections or surgery.